Sub-Saharan Africa is facing enormous challenges when it comes to tackling the coronavirus pandemic. By some estimates, only 20% of Africans will be vaccinated by the end of 2021. The entire continent might not be vaccinated until well into 2023. And one of the countries that has not yet received a vaccine is Zambia. So we go to that country's capital for more on the response there. We want to bring in Michelo Simuyandi on the phone now. He is the lead laboratory scientist for the Center for Infectious Disease Research in Zambia, and he's also a fellow supervisor for the American nonprofit Global Health Corps. Thank you so much for joining me on the phone. So, early on in the pandemic, I remember, some of the conversations we were having here was just how remarkably well Africa as a continent was doing in terms of containing the spread of the virus. There seemed to have been restrictions on flights very early on, and the continent seemed to be managing things. But what we have learned by watching this pandemic is, there are no boundaries, no borders when it comes to the coronavirus, and it will find a way. So I want to start with the conversation that we are having here in the U.S., which is about vaccinations. What is the status of vaccinations in Zambia? Is that even a conversation? Is there a conversation about timelines or which vaccines may be available to Zambia and when?
Thank you very much for that question. Regarding the conversation about vaccination, I think that conversation is alive in Zambia. And the current conversations are around the Ministry of Health trying to find out which particular vaccine that we can be able to access and deploy. And the mechanisms that are there for the country like Zambia would be through the COVAX, which is a WHO and CEPI driven initiative. So the conversation is there, and we hope that within the next few days or maybe months, a decision can be made about which vaccine, and then depending on the vaccine and what is required on the resources for deploying it, then we can be able to deploy the vaccine.
So some people might look at the numbers as they are on paper for Zambia and say, well, Zambia has a relatively low death rate for the coronavirus. Why do you still think it's important that everyone be vaccinated there, but also in other African countries?
Thank you for the question. I think that the challenge that we have is that this focus, around key people who we are calling high-risk populations. I think that if you give an example of healthcare workers who are, the first responders, and as they are working, they are at high risk, if then you lose the healthcare workers in a healthcare system that is stretched in terms of numbers of those healthcare workers, then the devastating effects and downstream effects for that would be felt by the population, not only in the context of corona, but because of these other infectious diseases that we do face. So if we did have a vaccine, which we are hoping we would be able to have, I think deploying in populations like healthcare workers would actually be more beneficial to a country, even though the general population would have a low death rate.
Yeah, that makes a lot of sense. These frontline workers are the ones that are not only there for coronavirus, but for heart attacks, for any other diseases. And if they are knocked out of the system, and I would imagine that you are probably already dealing with, not having as many frontline workers as you would like, it can have a devastating domino effect. So there are some people predicting that vaccinations will not be completed in Africa until 2023. What are your concerns when you hear that? Because, we're talking about many countries with different healthcare infrastructures, but as I mentioned, this is a disease, a virus that crosses borders with ease. So what are your concerns when you hear a timeline like that? And what do you think needs to happen to speed up that timeline?
Thank you very much. I think that deploying the vaccine should be able to start earlier, and Africa will definitely see the deployment happening much earlier than 2023. What may happen probably because of the availability of the vaccine and also the question around these emerging strains, whether the current first generation of vaccines would be effective against those. What I would see pragmatically happening would be a staged rollout, which probably would identify certain key populations at high risk, either the older people, those with pre-existing conditions, healthcare workers, and probably the children who are considered maybe the ones who may not have clinical risk but could be the super spreaders and carriers, but also maybe pregnant women. So if we can maybe focus on some of those key populations, I don't think that, I think that we would have an impact and see the real benefit for the vaccines. And then rolling out to the rest of the country, then would cascade later than that. But if we said that 2023 is only the time that African countries would get the vaccine, I think that's too far. We should be able to get the vaccine much earlier than that.
Well, let us hope so. And, you make a great point that if you use the vaccine strategically, you can have a tremendous impact on the spread of the virus. Michelo Simuyandi, thank you so much for joining us.
Thank you very much.